America is very diverse. You can hear people speaking many different languages on the streets. Language plays an important part in communication, and communication is a key part of our work as caregivers. If you and your patient can't understand one another, you might miss out on important clues that they are not feeling well. The language can also affect your patient's emotional health. When a patient speaks a different language than their caregivers, friends, and family, they may feel isolated and lonely. They may also be unable to tell a doctor or caregiver what is wrong. This can lead to a wrong diagnosis or to misunderstandings on what treatments to prescribe next. To identify language problems, watch and listen when your patient is communicating with others. 1. Observe the patient speaking with friends or family. Does the patient enjoy speaking a language besides English? Does the patient have someone to speak their preferred language with? Remember, just because you are listening to parts of conversations, you must still keep the patient's privacy. 2. Observe the patient speaking with a doctor or other medical professionals. Does the patient keep up with the conversation or seem confused? Confusion means they likely won't be following the doctor's directions after the appointment. Does the patient answer questions with short answers only? This could mean the patient is not understanding the full questions. 3. Look at the communication with the patient. Is the patient able to tell you what they need? If not, they may not understand what you are saying. Do you use physical gestures to help you communicate with the patient? This could mean that verbal skills are limited. For example, do you use a hand gesture like this to get the patient to follow you? If you notice or observe something about the patient's language or communication that directly affects their physical, cognitive, or emotional health, it's time to report it. Here's some examples. A language problem that affects physical health. George hasn't been to the dentist in 2 years, and his tooth has started to hurt. But he won't go to the dentist because he doesn't understand her when she speaks. Because he doesn't understand her, he tends to skip or resist going to his dental appointments. A language problem that affects cognitive health. George has dementia and cannot follow instructions from his physician because he cannot understand them. A problem that affects emotional health. For our examples, George is a fluent English speaker. However, you may have a patient that isn't a fluent English speaker. This patient may miss speaking his native language to others, causing him to feel especially lonely or out of place. If you notice a language problem, report it. You might say, Mr. Velasquez prefers to speak Spanish, but does not have anyone to talk to. He told me he feels lonely when he can't speak Spanish. He seems extra sad lately. In conclusion, to notice a language issue. 1. Observe the patient speaking with friends and family. 2. Observe the patient speaking with a doctor. 3. Look at your communication with the patient. If you notice a language issue, call your agency or send a message through your agency's app.